So in quick review, the first thing you do when you see someone go down is that you do a scene survey, which takes you about 10 seconds to make sure that the scene is safe. If the scene isn't safe and you put yourself at risk, a dead helper isn't a helper, they just end up being dead or injured in some cases. Once you're able to approach the scene, you kind of can determine what kind of help you need and how many victims there are and potentially what happened to said victims. Once you get on the scene, you start to look at the patient very quickly. This is called your primary survey. And during the primary survey, you need to decide if the person is an acute emergency, meaning you need to call 911 right now, or it's not as significant and probably needs to be seen but might be able to wait a while. If you decide it's an acute emergency, then you're going to go ahead and look for signs of life. To do that, you look, listen, and feel for breathing. You look by looking down at the person's chest with your ear over the victim's head for no more than 10 seconds. You're listening for breathing and you're feeling for a pulse. In an adult, it's the carotid pulse, same thing in a child. In an infant, it is the brachial pulse. After you have done that and decided if you need CPR, you go ahead and start if necessary. But let's say that in this case, your victim is conscious, they don't need CPR. So you've gone through all of that. You're going to look during what's known as the secondary survey, meaning they're maybe seriously injured or badly injured, but they don't need CPR. You start to look for identifying factors to see what their background history is. Some patients wear something called a medical alert identification. It might be a bracelet like you see on the screen, or it might be a necklace. In some cases, it'll tell you the allergies. It might tell you a medical condition, like if the patient is autistic, or a fall risk, or if they have a medical condition like cancer, Sjogren's syndrome, Parkinson's disease, multiple sclerosis. For some of you, you will not wear one of these. Instead, what you will do is you'll look in the medical alert on the phone, and you can set that so that people can access it without the passcode, and people can get into your phone and see if you currently take any medications or have any medical concerns. In determining if someone is healthy or not, there are 3 specific conditions that must be met in order for the body to be considered healthy. The main thing in your body is that you have to have blood flowing throughout it, because your blood carries vital nutrients that help you to survive, oxygen and other nutrients that make the body function. So in order to be considered healthy, you want the heart to be working well. Remember, it is going to be beating at approximately 100 beats per minute, approximately 8 beats per second, if you think about it that way. It's that lub-dub sound that we've talked about in the past. You want to make sure that there is an adequate amount of oxygen-rich blood going throughout the body. So you might have blood flowing, but if you don't have enough oxygen in it, then you'll start to see conditions like jaundice, cyanosis, and you might develop secondary conditions which can lead to you having to be seen by a doctor. You also want the blood vessels to be intact and able to adjust to blood flow. So if you're having a fever, you want the blood vessels to be able to be open nice and wide to try to push blood through. And if you are bleeding out because maybe you have a severe cut, you want those blood vessels to constrict or get really small to keep the blood from flowing too fast. We'll talk more about this as we get through today's notes. So when you say the word shock, what you have to think about is that it is always an emergency. Typically, for a patient to go into shock or a victim to go into shock, they have to have had some sort of major injury occur to them that was usually pretty sudden. And what happens is your body gets into a condition in which the circulatory system, so all of your blood vessels and your heart, are not delivering enough oxygen-rich blood to the body's tissues and other vital organs. What happens is that those organs and those tissues, they don't function properly. And so what happens is that multiple organ failure can happen. And if those organs aren't working correctly, it can lead to you facing death. It is a response to maintain adequate blood flow. So typically what'll happen is that there'll be a drop in blood pressure, which reduces the flow of oxygen and nutrients to the brain, the heart, and the lungs. And when that blood pressure bottoms out, a message is triggered in your brain telling your heart to speed up. So your heart might speed up trying to get more oxygen throughout the body, but it's not beating as long and the contractions aren't at an adequate timing. So it's not pumping through oxygen-rich blood like it needs to. If your blood pressure speeds up, then your breathing is going to speed up because you're trying to gulp down air, but you're not gulping them down at an adequate rate. So you're getting a shallow amount of oxygen in your body. So that depleted oxygen getting into the bloodstream and then you not being able to pump it effectively throughout the heart, the lungs, and the brain will cause you to go into shock. When you don't meet that demand and your blood doesn't circulate, you should be really concerned. And remember, you're calling 911 because shock does kill. So typically the signs and symptoms, which S/S is the abbreviations for, occur pretty quickly. And the first sign or symptom of shock is always your blood pressure dropping. Remember, you want it to be 120 over 80. And if it's not that, or if it's not less than that, you have to be concerned. So some of the other symptoms that might occur are rapid and shallow breathing. Your skin gets cold and clammy because you're not pumping that warm oxygen-rich blood through it. You have a very rapid, very weak pulse, which leads to dizziness, fainting, or weakness. Patients that go into shock might come across as pretty restless and really irritable because they have lost oxygen and aren't feeling well. They also might have an altered state of consciousness because they're not getting enough oxygen, which can in turn lead to nausea and vomiting. So what do you do if a patient goes into shock? Well, obviously you're calling 911 immediately. You need to let them know the condition of the patient, patient's name and age, the address where you're located, and all of the other things that we talked about back when we talked about calling 911. You also want to care for the patient. The best thing they can do is lie flat on the ground if possible to lessen the pain. The reason pain matters is because pain causes an increase in stress and speeds up shock. It messes with your heart. Usually it tries to increase blood pressure. You need to control external bleeding. You're already not getting enough oxygen-rich blood to the rest of the body, so if the little bit of blood you have circulating gets out of the body by bleeding, you're in big trouble. You should try to maintain a normal body temperature, which is hard to do when someone goes into shock because their blood has thinned out, and so they tend to be colder. So normal body temperature is really important. Do not give them food or drink, and this includes water, because if they get to the hospital and they need surgery for a different condition, they can't have anything in their stomach. Also, you want to be reassuring. You don't want to look at your patient and be like, oh, dude, it's not good. You're going to die. Or, man, we can't do anything to help you. You've got to be more positive than that. So have that glass half full approach with your patient and let them know that you are doing everything that you can to make them better. You're monitoring the ABCs, which as a reminder is airway, breathing, and circulation, and then their overall condition to make sure that they're in a good shape until EMS arrives and can take over. So the instructor will pause this video to put the Khan Academy video on for you in class. You need to make sure that you write down the 4 questions, and you need to answer them completely, as this is an assignment. If you were not at school when you are viewing it, please make sure you go to Khan Academy and look at the types of shock. You will need to turn this assignment in if you would like to receive your points.
Minutes ago on ABC World News with Diane Sawyer, you saw a story about a Goodhue, Minnesota man who survived after first responders performed CPR on him for more than an hour and a half.
Amazing story. ABC 6 News sat down with him as well today to get more on his story. ABC 6 News reporter David Springer joins us now live in our Rochester newsroom. And David, a lot of people say he might not have survived if this hadn't happened in such a small town.
Yeah, the town of Goodhue only has about 800 residents, but in what some people would call a typical small Midwestern town response, a handful of those people banded together to perform CPR on a man that most people probably would have just given up on.
I don't remember going to Don's. I don't remember getting out of the car, and I just don't remember blacking out.
5 days later, Howard Snitzer of Goodhue, Minnesota, woke up in the ICU at Mayo Clinic. Snitzer learned he had suffered a massive heart attack outside of Don's Foods in Goodhue. He also learned that first responders had performed CPR on him for more than an hour and a half.
You know, to go so long into CPR and to resuscitating someone is, you know, I think what the previous record was like 45 minutes. And they worked 96.
Al Lodermeyer, who owns the garage just across the street from where Snitzer collapsed, was one of the first people to start CPR, and he, along with about 20 others, kept going for that 96 minutes at the urging of a Mayo Clinic paramedic.
Yeah, until he gives up or until they say, you know, enough is enough, we just keep rolling, and it's fortunate we had a lot of help.
Less than 50 days after his heart attack, Snitzer is home and doing just fine. Amazing, considering the fact his heart wasn't working and he had no pulse for an hour and 36 minutes.
It seemed like there was nothing to work on, really, but they just kept doing it and doing it and doing it, and, you know, it's like you're not going to die on my watch.
And Snitzer has everyone from Lodermeyer to the Mayo Clinic paramedics to thank, although thanks doesn't even begin to sum it up.
I mean, I love them. I love those people. I mean, what can I say, you know? I mean, it's pretty overwhelming to be in a room full of people that were not going to walk away and give up on you, you know. They're all angels, as far as I'm concerned.
Truly amazing story. The woman you saw in that story, by the way, is Howard Schnitzer's significant other, Tammy Ryan. And even in an even stranger twist to this story, her husband actually passed away 6 years ago from a heart attack, and the men who tried to save her husband back then were the same men who saved Schnitzer this time around. In Rochester, David Springer, ABC 6 News.
Yeah, an incredible story. A good group of people there in Goodhue. Thanks, David.
So again, in review, when you're checking an unconscious person, make sure you survey the scene. It's for scene safety, to determine the number of victims, to determine what you might need on the scene. And number one is, again, your safety. If you approach a scene and it's not safe, you could injure yourself. Once you determine that the scene is safe within 10 seconds, make sure you tap the shoulder of an adult or child and say, "Are you okay?" No response, call 911. On an infant, it's the same thing, except you tap the bottom of the foot. Send someone else to call 911 or have someone else use their cell phone to call 911. And if they don't have their cell phone right there, tell them to come back to you with the phone. You want to make sure you check for an open airway and look for normal breathing, and immediately look for severe bleeding, because those are two conditions that have to be treated right away in order for the patient to survive. When determining the severity of injury, you are looking at the signs of life. So number one is consciousness. Are they alert and awake and oriented? Are they sort of alert, meaning that they are breathing and they're kind of aware of what's going around them, but they're not 100% with it? Or are they unconscious? Or maybe they have transient consciousness. They're coming in and out of being awake or not. You're looking at effective or normal breathing. If it's too fast or too slow, too loud, too soft, any sort of weird noises that don't make sense. You're also looking at circulation. Is the heart pumping adequately? Do they have a normal pulse and blood pressure? And then you're looking at skin characteristics. Is their skin a weird color? Is it cyanotic, as in blue? Is their skin jaundiced? Do they have normal capillary refill? What's going on with the skin, and is it in good working order? There will be a quiz over this unit, so please make sure you review your notes and go back and play this video as much as needed. The Khan Academy assignment is due most likely tomorrow for you, unless I've said otherwise. Remember that we start the CPR unit in the next week. If you have not, you need to purchase a mask for $5 from my classroom, and you will need to pay $2 for your certification card.